Hi, I'm Dr. Arlan. I'm a licensed naturopathic doctor as well as a licensed acupuncturist. I'm trained in two systems of holistic medicine, Eastern and Western, and I also have a background in physics and engineering, and I used to work as a rocket scientist. Now, what all that means to you is that I have a few more tools in my toolkit than the average doctor, and as a result, I've been able to figure out a few things about health and wellness that seem to have been missed by most other practitioners. If you were to take a poll of your 20 closest friends and relatives, I'll bet you'd find at least several who've either had their gallbladders out or have gallstones right now. It's almost becoming a chic rite of passage to have your gallbladder out. I even had one patient have hers out because it was the first time she was ever able to use her healthcare insurance. I've known people who had minor abdominal pain, were diagnosed with gallstones, and then scheduled their surgery 2 months in advance around their work and vacation schedules. If you read my book, you'll find that there's actually a few small instances where having your gallbladder out is the lesser of several evils. If you can go out and schedule your surgery 2 months from now, that's not one of those times. What's that you say? You have gallstones and your surgeon is recommending you have it removed and no one's talked to you about the risks of surgery? Before I tell you about all your natural options for gallstone treatment, let's go over some of those risks that they aren't telling you about. In the US today, there's about 1 million new cases of gallstones diagnosed every year, and about 3/4 of them, 750,000 people, will undergo the conventional treatment of choice, which is to have your gallbladder surgically amputated. And of those, about 1%, or 7,500 people in this country every year, will die as a result of side effects and complications of gallbladder removal surgery. Ironically, and even more important, of the ones who do survive surgery, about 25%, that's 1 in 4, still have the same pain they had before after surgery, and in a few cases, it's even worse. And from my perspective, even more importantly, having your gallbladder out does absolutely nothing to correct the underlying conditions which led to you forming gallstones. And those same underlying conditions are risk factors for a lot of other worse conditions, such as obesity, diabetes, heart disease, and strokes. These are some of the reasons I wrote my book, Keep Your Gallbladder. This is now the definitive book in the world on the natural treatment of gallstones. Go to mtshastahealing.com and get my book, Keep Your Gallbladder. Thank you for watching.